Welcome everyone to the microbiology course. This is the discussion around safety in the microbiology laboratory. The topics that we will go over here can apply to the other courses as well. You should still take notes because remember you will have a section involving safety on your actual exam. So one of the things that we need to discuss regarding safety in microbiology is routes of infections. And you have to know routes of infections in order to understand how you can practice safety in the microbiology laboratory. So one route of infection is airborne, and we went over this briefly in the introduction, but we're going to have a little bit more details. So airborne means there's aerosols that may come when you centrifuge a sample that isn't stoppered up. That can happen with chemistry samples, that can happen with microbiology samples, or hematology samples with blood bank samples. So you have to be aware of this. First thing is that you should not open the centrifuge while it is still running. You should wait for it to stop, and therefore you do not create aerosols, and airborne organisms can get into the air, and actually you can become infected. The other thing that you can have is heating cultures of specimens too quickly. So when you're sterilizing your inoculating loop in the Bunsen burner, sometimes it can just kind of give a little extra burn back, and then you can see something kind of fly off of the loop, and that's like bacteria flying off of the loop. Another case in which you can cause an infection is removing the stoppers from the tubes or leakage from a container that holds contaminated samples. So if you're not wearing gloves, if you're not handling samples under a hood in microbiology, you can open yourself up to possible infections. Next, with routes of possible infections are ingestion. With ingestion, the infection can occur as a result of failure to wash your hands. So you go to work in microbiology, or any other part of the lab for that matter. You work with the bacteria, the viruses, and you don't wash your hands. And then you go take a break and you go eat, drink, smoke, apply cosmetics, or any of that kind of stuff. You can get an infection. The alternative to that is you work in the laboratory and you work by yourself. So you decide you want to eat, drink, smoke, and apply cosmetics within the laboratory. You can get an infection that way. This is why those are things that you should never do in the laboratory. Eating, drinking, smoking, applying cosmetics, including lip balm, are not allowed in the laboratory. And of course, mouth pipetting is not allowed. The next possible route of infection is direct inoculation. This means you can have a needle stick, or you can have broken glass. Um, Most hospital laboratories do not work with animals, but if you are in a laboratory that works with animals, you can definitely have an animal bite. You can get a scratch on your fingers or a scratch from something. You can have a scratch on your arm or your hand, and then actually that scratch is an open wound. So maybe you don't have it covered and it can become infected. Another way you have infection is the mucous membrane that's normally around your eye. So the infection may occur if organism can directly enter through the mucous membrane conjunctiva of the eye. That's when you are wiping your eyes while you're in the laboratory. You can even have your gloves on and they're dirty and wipe your eye, and I actually have seen people do this. Arthropod vectors, so ticks, fleas, mosquitoes, they carry different bugs. Of course, we know about malaria. That's one that everyone thinks about. Lyme disease is another one. So every facility has to have an exposure control plan, and you need to know this for all the courses. And so it's really good to just keep this in your back of your mind. The exposure control plan is a safety program It means that new hires and have to have safety education done, and then you have to have it done again annually. Some of you who have taken my other courses, you've already know this, or hopefully you know this. And if you have an exam, hopefully you won't miss it. Universal precautions means that there's a reduction in the risk of infection from blood-borne pathogens, specifically HIV, hepatitis B virus. It only applies to samples that contain visible amounts of blood, so semen, vaginal tissue, body fluids, and the actual blood sample. Standard precautions is different. This is preventive measures applied to every last patient designed to reduce of infection in healthcare setting. The only thing that's not really included is sweat, but all other body fluids, tissues, brain matter, any type of sample you can think of coming from a patient is included in standard precautions. So therefore you should know that you have to know the difference between universal precautions and standard precautions. Let's get into the general safety guidelines, and again, it applies to all the courses. Don't eat or drink in the lab. Don't smoke in the lab. Don't apply cosmetics in the lab. Wear your protective eyewear with side guards. For those of you who are working in labs and dealing with COVID-19, remember you have to have on face shields and face mask while you are facing patients. Protective eyewear is worn in all labs using hazardous chemicals. Regular prescription lenses are not suitable unless goggles are worn over the top of the prescription glasses. That's very important. That has come up as a question recently. Contact lenses in those labs where volatile fumes are present are not recommended because the lenses may absorb the volatile fumes. There you go. More face shields with goggles and masks are recommended with working with agents that can infect the skin or mucous membrane, or when splashing is going to occur. Use of gowns, aprons, and lab coats are required. Long sleeve gowns. Notice you can't just wear any old thing. You have to cover the arms completely. All protective clothing should be worn only in the lab. When you leave the lab, you should not have them on. Shoes have to cover the entire foot. No open shoes such as sandals are permitted. Hair, as always, should be worn in a manner that prevents contact with contaminated materials, as well as moving equipments and parts and instruments, centrifuges, anything that the hair can be caught in. Same guidelines applies to those with beards. You can't have long beards that could get down into any type of instrument or that could become in contact with contaminated material. Jewelry should not dangle. You have to wash your hands constantly. You can use an antibacterial sanitizer as long as your hands are not visibly soiled. There are eye wash stations that must be 100 feet or 10 seconds of travel from any area and hazardous chemicals are used. Emergency showers are required if there's corrosive or caustic chemicals. And respirators must be made available to those working in areas where the air may be contaminated with gases, fumes, vapors, or other harmful compounds. And glassware should be discarded in a puncture-resistant container when broken or chipped. Needles should never be recapped, and centrifuges have to minimize the production of aerosols. Uncovered tubes or flammables should not be centrifuged. PPE, personal protective equipment. Those are gloves, facial protection, goggles, face shields, protective body coverings like lab jackets, and a HEPA, high efficiency particle air respirators for those who may come into contact with tuberculosis. And in some places, those are used since there was such a shortage of masks due to COVID-19. Hepatitis immunization has to be offered free from the hospital for everyone, and that is because hepatitis infections are common in the hospital, and most hospitals will not employ you if you are not able to get that immunization, which is a series of 3 shots. So let's talk about engineering controls. 1, there's a biosafety level 2 hood required. 2, a biohazard label must be present in areas where infectious specimens or cultures are stored or present. And 3, puncture-resistant containers must be available. I think in micro overall, you have more safety questions than the other areas. I'm not exactly sure why, but that's the feedback I've received from other students. The last thing is the biological safety cabinet has to be available to protect against aerosols. The main question that I see is the biological safety cabinet classes. The classes are 1, 2, 2A, and 3. Most labs have at least a 2A. Every laboratory has to have what's called a post-exposure plan. This means what happens after you have been exposed to a biological agent. Accidents or safety incidents have to be reported. You are offered emergency medical treatment that you do not have to pay for. Clinical and surgical follow-up on exposure to hepatitis B or HIV. That means that baseline tests will be done, so they will draw samples from you and find out if you currently have hepatitis B or HIV, and then they would do tests 6 weeks later, 3 months later, and 6 months later to make sure that you do not develop one of those disorders. And normally what happens in a laboratory is needle sticks of some sort, from drawing a patient, from contamination from an instrument, or sometimes broken glass happens, but mainly it's needle sticks. And then there has to be documentation and follow-up, and this have to be kept in the file. Corrective actions to prevent issue in the future. Most of the time, people do not want to report that they've had an incident. When you report that you have an incident, the facility has to investigate. This is not to fire you. This is to decide if whatever happened to you could possibly happen to someone else. Of course, you're not going to be tested on this part, but you are going into the hospital to work, into labs, into doctor's offices, and I just want to make you aware of this. The most important thing for you to remember from this slide, 1, is that items should be decontaminated prior to disposal, which means if you can remove dried blood from an object, remove dried blood from an object. Contaminated materials are placed into 2 leak-proof bags. Puncture-resistant containers are used for sharps, and then all of this must be labeled as a biohazard. Autoclave, this is a big thing. Of course, it comes up on the question as a question on the exam. Steam under pressure. There's 2 options: 121 degrees at 15 psi, 15 minutes for all known pathogens, and then 132 degrees, 15 psi for 1/2 to 1 hour for infectious medical waste, which normally comes from like OR room. Chemical germicide, the cytal means kill, so they kill germs. There's procedures of sterilization, physical or chemical process that kills all microorganisms, including spores. Disinfection destroys most microbes but does not kill the spores. And then biocides, chemical agents that inactivate the microorganisms. A static means it inhibits growth. Cytal means it kills the target. These are definitions, and this will help you when it comes time to take an exam. If you recognize the words and understand what they mean, it may help you figure out the question. Liquid decontaminants, 70% alcohol or 10% bleach. Those are decontaminants, and notice in parentheses there's a 10-minute contact time. That means you have to put the bleach on the counter, let it sit for 10 minutes before wiping it up. Fire safety, you have to be aware of what could cause an ignition, open flames, heating elements, spark gaps. Proper storage of flammables and combustibles in safety cabinets or safety cans is important. And then proper transfer of combustible chemicals to a different area. So if you use ethanol, how do you carry it? How do you pour it over into another container? You have to understand that there's a safety data sheet that's going to tell you how to do that for each chemical. Types of fire extinguishers. There's type A, which is for water and is used on combustible materials. There's type B, which is for carbon dioxide, and it's used for extremely flammable liquids. There's type C, which is for dry chemicals. It's used on electrical fires and wiring. And then there's type D for combustible metals used for fires involving combustible metals, of course, sodium, potassium, magnesium, and potassium alloys, which should tell you that we have those in the laboratory, which means we have to have a fire extinguisher that at least meets that requirement of type D. There's a class K, dry and wet chemical extinguishers used for kitchen fires. One thing you're going to have to know for every course, safety data sheets. Safety data sheets have the manufacturer information, physical and chemical characteristics, hazard data, which includes fire, explosion, reactivity, health hazard data, precautions, and control measures. There's always been a question about safety data sheet in the lab general section on every exam so far. Just so you can be aware, there are various categories of hazardous chemicals. They can be corrosive, toxic, carcinogenic, ignitable, or explosive. And you just have to basically know that. You won't have too many questions on these. This is the last slide for this series. And this is just information that will help you. You may not necessarily be tested on this on your exam, but if you go to work in a laboratory, you might want to know that some chemicals have what's called a PEL, permissible exposure limit, which is the legal limit for exposure of an employee to the chemical. And then there's a short-term exposure limit, which is the maximum limit a worker can be continuously exposed to a chemical for up to 15 minutes without danger. I just want to point that out to you so that when you're in the lab and different chemicals are introduced, you can actually read the safety data sheet and make sure that there's no exposure risk, especially if you're a woman who may become pregnant. All right, let's go on to the next course.